Laparoscopic surgery, also known as intra-abdominal minimally invasive surgery. This surgery uses laparoscope and an endoscopic camera to perform certain operations through small incisions. The popularity of this surgery is mainly due to the advantages that offer to the patients. Patients will encounter shorter hospitalization, shorter recovery time and less pain.
However, the main problem in this surgery is visual limitation.
The current possible solution for visualization problem is the use of augmented reality technology in laparoscopic surgery. Augmented reality is a technology that combines the virtual element with the user's environment and enable real-time interaction between them. With augmented reality technology, it is very useful in guiding surgery operation. Augmented reality system can display the preoperative 3D model in the proper place with respect to the exterior anatomy of the patient. This system also can provide guidance for surgeons by showing virtually the parts that hardly to be seen. Registration is the critical aspect in the implementation of laparoscopic augmented reality. What is registration? Registration is accurate alignment when virtual image or object blends with real-world image. Besides, registration is the biggest problem in building effective augmented reality system. Registration accuracy is the main thing in laparoscopic augmented reality system. Today, registration accuracy is still a big challenge in laparoscopic augmented reality due to real-time of deformation organ.
There are two registration approach used in laparoscopic AR to improve the registration accuracy. The first approach is interactive registration. The second approach is automatic registration.
Research methodology. The research methodology used was qualitative research. Data collection. Data was gathered by reviewing and comparing the proposed systems or method for laparoscopic AR registration of selected research papers. To begin the research methodology, search method was used to obtain research papers from academic database. Four type of academic database were used. They were Science Direct, EE Digital Library, Google Scholar, and Springer Link. A query was conducted for the search engine, with terms augmented reality registration in the title, along with terms related to laparoscopic surgery. There are 8 selected research paper. Registration taxonomy. I stands for iterative. A stands for automatic. This taxonomy was used to examine and classify the proposed system or method, according to interactive and automatic registration. Analysis of proposed system or method. The concept of interactive registration, it relies on manual inputs, from a surgeon, to register preoperative data, to the laparoscopic image. Virtual organ is manipulated, until its projection on the laparoscopic images, match the current shape of the organ. This registration also requires, the selection of landmarks, on the virtual preoperative model, and the intraoperative view of the organ. There are 4 selected research papers about interactive registration. The first paper is about 3-dimensional navigation technology, with the laparoscopic navigation pointer. This method allows registration using radio-opaque markers. The position of landmarks was initially determined using preoperative imaging, and subsequently outlined during the surgery with the navigation pointer. The laparoscopic pointer could help surgeons identify the correct location of vessels. The second paper is about augmented reality navigation system, based on preoperative computed tomography image, using optical tracking device. Optical tracking device was used for registration between volume image and body surface markers, to guide laparoscopic splenectomy, and the registration accuracy achieves the acceptable level. This system can provide the real-time anatomical information for surgeons. The third paper is about image overlay navigation by markerless surface registration. Computer-generated dynamic three-dimensional images were projected onto the patient's body surface. Surgeons can see the displayed preoperative data on the patient, minimizing the movements of the gaze. This system can boost the surgical performance by minimizing dissection and resection of neighboring tissues and organs. The fourth paper is about deformation three-dimensional model architecture for interactive augmented reality. 3D model is used to stimulate the transformation of soft tissue's shape. During registration, the liable identified organs are selected as landmarks. There is a software architecture that provides manually interactive adjustment in the registration. The sidebar is used for controlling the patient's 3D model, and changing its properties such as manipulate the deformation of the organ. Automatic registration for laparoscopic surgery. The concept of automatic registration. The surgical tool's tracking limitation is solved, and human interaction is not required. The most important criteria for automatic registration is to recognize the location of the targeted organ in real time. There are 4 selected research papers about automatic registration. First is automatic registration of Da Vinci system to the image of transrectal ultrasound. This system is used for urology surgery, and the manual benchmark for localization is substituted by automatic localization method. The registration error between the Da Vinci frame and truss frame are investigated for each test case, followed by evaluating the localization accuracy. Second is our application with physics-based elastic registration. This application can adapt to topological changes detected in the intraoperative model automatically. Besides, the virtual model with internal structures can be kept coherent with the deformation of real organ after an incision. Third is continuous volumetric computed tomography for LiDAR in laparoscopic surgery. Automatic registration was used to map the preliminary and the intraoperative CT scans. Also, the accuracy of the registration was inspected quantitatively and qualitatively. LiDAR is better than conventional R, in terms of reduction of the misregistration problem. Fourth is projective biomechanical soft tissue with fully automatic featureless non-rigid registration method. The main contribution in this method is dynamical adjustment of preoperative model to the current surgical laparoscopic scene. The registration procedures do not require tracking process, as the procedures utilize dense depth matching. The findings after reviewing the 8 proposed system or method. Interactive registration is limited to rigid registration. It cannot adapt to organ deformation. Rigid image will become untrue if the surgical anatomy of the patient changed by surgical tools. Registration is performed manually using the software application for deformation of 3D software architecture. Automatic registration reduces the complexity of registration. It deals with real-time and non-rigid registration. It can decrease the misregistration in conventional augmented reality. It is able to handle dynamic organ deformation. Conclusions. The findings imply that automatic registration is a more time-effective approach, and it can handle the organ deformation with minimum registration error gained. Automatic registration has been recognized as the most effective registration approach to increase the R registration accuracy in laparoscopic surgery at the current stage.